Stay connected. Make sure you hit the subscribe button. Tim Bennett here from the Cortland Voice, and I'm here with Dr. Seemant from the Cayuga Center for Healthy Living. Doctor, how are you today?
I'm doing very well. Thank you for having me today.
Awesome. So today we're going to be speaking about osteoarthritis. I want to learn about that. Tell me what you can tell me and the community about osteoarthritis.
That's good. So yeah, I mean, osteoarthritis is very common disease, and it creates a lot of health and financial burden to the community. It's basically a degenerative joint disease where the cartilage of the joints get denatured over time. And previously, it used to be thought of as wear and tear osteoarthritis. But now, as we know that more evidence is coming, it's supporting that it's the inflammation that continuously deteriorates the cartilage over time.
Okay.
And it's progressive disease. So, and as we know, there's no way to prevent it, but there are only few things that we can do other than the medications because they're none available at this time. So we can talk more about that later.
Gotcha. Okay. Now let me ask you this. What are the symptoms? Like if whether somebody's an athlete or not, how can they tell what that feeling is? Because I mean, obviously people know what their leg is, but they might not know what cartilage is, or they might think it's a regular thing.
Yeah.
Tell me that.
I'll briefly explain a little bit. I brought a joint model. So let's say this is the knee joint, and these are the two bones making the joint.
Okay.
So the blue is where the cartilage sits. It's a
Okay.
smooth lining for the joint, so it glides properly. And as the cartilage wears out, there becomes more problems. So as the disease progresses, there is pain, which is the most common symptom with osteoarthritis. Over time, there is degeneration that affects and changes the overall structure of the joint. There's also stiffness, which is very commonly reported by most of the patients. And stiffness is classically inactivity related. For example, if you sit in a car for a little while and then you stop and to get out, you feel like, oh my God, that knee is stiff. If you sit for a while, otherwise, like you're watching a TV program or a movie, and then you try to stand up and you're like, oh no, this is not good. So, stiffness, pain, limitation in the range of motion. You cannot get your legs straight, you cannot bend it all the way. This is mainly for the knee I'm talking, but it can affect hip and other joints as well.
Understood. So being that like, we're in a pandemic and many weren't able to get in a gym for a long time, are you seeing like an increase in this or?
So it is a long haul issue. So people who are not able to be active as they used to be, like for example, swimming, treadmill, biking, there is a more of problems because motion is lotion, as to say. So if you're not being able to stay active, it causes more of problems with osteoarthritis.
Gotcha. But let me ask you this. Once you do get the patient, how do you treat them? Like what is the treatment methods like?
So
How do you
first
make
of
them
all,
feel better?
that's a great question, and I would say we started the osteoarthritis clinic here at Cayuga Center for Healthy Living with Cayuga Medical Center, and goal is to provide comprehensive care. It's just not one thing that works. There are many things that, in collaboration, play a big role. For example, first of all, when the patient comes in, we do a detailed evaluation. We need to have a diagnosis first. So diagnosis is mainly clinical, like with symptoms and signs and examination of the patient. And after that, we get x-rays here, which are available on site. Also, we have ultrasound available with which we can look at the joint itself, how much swelling it is, how much other pathological findings are seen on the ultrasound. And then once the diagnosis is made, then we discuss the treatment options, which are, first of all, physical therapy plays a big role. And it has been shown by many research papers, and there's a lot of evidence to support that it has shown to be preventive in the disease progression. That's one thing. Second thing, if somebody is in a lot of pain, we can do a corticosteroid injection in the knee joint with ultrasound guidance, and that relieves of pain pretty much dramatically. So they are pain free and can get to physical therapy if you're not able to before because of pain. Also, we also discuss about other preventative approach. For example, somebody who is overweight or has more weight or in obese range, we'd always discuss about weight loss. And there we collaborate with our partners with like Cayuga Center for Healthy Living with medically supervised weight loss programs. So that's why this is a very good area and spot to work up patient for osteoarthritis and provide comprehensive care, because we have a physician here with the imaging modalities, then we have weight loss programs, then we have physical therapy downstairs. So in a way to provide comprehensive care in
And
one.
then when do you know like whether you need surgery or not? I mean, obviously there's preventative, and I know some people are worried about it, but when do you know, okay, like I really need to get it? I mean, is it based on an age? Is it based on the person? Like, how do you
So
decide?
how I explain it to my patients is uh, how much it's affecting your quality of life.
Okay.
If you are not able to get to your daily chores, if you're having difficulty getting to the bathroom, if you're having difficulty going upstairs, so that's definitely a problem. And if conservative treatment is failing, for example, injections are not providing relief, physical therapy is helping but not to the point, you are maxing out on your pain medications, or you're needing narcotic pain medications or pain medications every single day of your life, then it's time that you should think and consider about joint replacement. And we collaborate with Dr. Blake, who's a joint replacement surgeon, and appropriately guide the patient when they need surgery. Because one big problem is that you don't want to continuously treat a patient and he's or she is in pain every day, and you delay surgery when it's needed sooner.
I see. Let me ask you this. If someone wants to become a patient of yours, how
Mhm.
can they do that? Like, what are the options? Are you seeing in person? Are you doing telehealth? Like, how does that work?
We are doing both, and I think telehealth is very helpful for patients who cannot drive or cannot come in or
Mm.
have other restrictions. For example, they're worried about exposure to COVID. Then definitely telemedicine is available. They can always call our office and set up an appointment. We are seeing in person as well, and we take all the precautions as guided by the state health department and as per directions from infectious disease and Cayuga Medical Center's guidelines. So every room is cleaned appropriately after every patient, and due diligence is paid for that.
Great. So, are you seeing patients in Cortland or in Ithaca or both? Like, how can a patient, somebody watching this, come see you?
Mhm. So I'm seeing patients in both locations. It's very easy. You just pick up a phone and call our office number,
Mhm.
and the front desk staff will guide you appropriately to the location.
Okay, perfect. Any closing thoughts? Like, what would you want to say once again to someone watching this? I mean, I know they've heard from you and heard these different things, but like heart to heart, from you, doctor, to them.
Perfect. No, that it's. I would say to have a closure on this. Um, Osteoarthritis is a very common problem and sometimes get ignored or underdiagnosed. So somebody who's experiencing pain,
Mm.
limitation in his activities, or needing pain medications every day, see that the joint is maybe swollen, and most of the times it's non-traumatic or without any injury. Then do keep in mind that it could be osteoarthritis, and always try to reach out sooner than you should, so that we can appropriately evaluate it and provide the most needed care that you need.
Beautiful. Well, thank you, doctor, for joining us once again today, and to the community. Thank you for choosing the Cortland Voice.
Thank you so much for having me. I appreciate it.
Stay connected. Make sure you hit the subscribe button